Pregnancy is the time in every woman's life where there is so much to think about, and oftentimes the mouth is overlooked. While a woman is pregnant, all of the changing hormone levels may cause an increase in dental problems that she may not even realize are there. Women can decrease their chances of dental problems during pregnancy if they ensure good habits of the mouth on a day-to-day basis. For example, brushing teeth daily at least twice a day and flossing is a small and effective way to prevent the risk of cavities. Along with brushing and flossing at home, informing the dentist of the pregnancy is very, very important. If there is a problem occurring in the mouth, such as infection, the dentist can take care of it before it becomes more problematic. One question that arises is whether visiting a dentist is harmful to the baby. Visiting the dentist is not only safe, but recommended. Although performing dental work is safe, it is best to avoid any potential risks, no matter how small. Informing the dentist of a pregnancy is important when it comes to x-rays. Especially because if unnecessary, it is just putting the baby at risk for radiation and complications associated with it. Even though the risk is minimal, the dentist may put off taking x-rays until after the baby is born. In some cases, dental x-rays may not be unavoidable, but the dentist can take absolute precaution to make certain of the baby's safety. In other instances, the dentist may need to use or prescribe medication as part of treatment. Some medication is safe to use for limited use during pregnancy and should not be used at all. Even if concerned, women should always keep in mind of the minimal risks that occur when visiting the dentist, and should see the dentist regularly during pregnancy for oral exams and professional cleaning of the teeth. Going to the dentist actually significantly reduces the chances of getting gingivitis, because with a better cleaning achieved by a professional, increasing oral care of the mother and child. While seeing the dentist regularly does well for oral health, it shouldn't be the only solution. Pregnant women can decrease dental health problems by ensuring the oral health with a vigorous routine at home, followed by healthy eating habits as well. Some women will experience food cravings, including a desire for sugary foods, which increases the risk of tooth decay. If nothing but sweetness will satisfy a craving, women should be aware that there are many healthier alternatives. During pregnancy, women should also increase their calcium and vitamin D. More calcium will protect bone mass and is nutritional for the developing baby. Good sources of vitamin D would be yogurt, milk, calcium, fortified soy milk, cheese, eggs, salmon, and margarine. An increase in vitamin D helps the body to make use of the calcium. Healthy foods for the mouth are not only good for the mother, but the nutrients found in these foods are essential for the baby's developing teeth, gums, and bones that are also needed for growth. Poor nutritional diet from the mother actually plays a huge toll on the baby. When it comes to food, some women will at one point or another experience morning sickness, and oftentimes food can trigger this as well. The reason for the morning sickness is due to the pregnancy hormones that make the ring muscle softer. The ring muscle in the stomach keeps all of the food inside. The steps that should be taken after morning sickness include rinsing the mouth with water, followed with a mouthwash, and brushing the teeth at least an hour after vomiting. Another alternative, too, is rinsing with a bicarbonate rinse, which includes warm water, a tablespoon of baking soda, and a half tablespoon of salt. When pregnant, hormones are significantly increased, and that actually puts women at higher risk for gingivitis. Gingivitis causes swelling and tenderness, and left untreated, gingivitis can affect the supporting tissues that hold the tooth in place. Gingivitis is actually the most common oral disease in pregnancy. Oftentimes, gum disease will go unnoticed, but there are a few distinct signs and symptoms that should be looked out for. Some warning signs include red, tender, and/or swollen gums, pain in the mouth, and bad breath. Not only does gum disease turn for the worse in the mouth, causing things such as bad breath, loose teeth, and receding gums, but oral bacteria can travel through the bloodstream and cause infection to any part of the body, which is why good oral health is so beneficial for both the mother and child. Periodontists claim that the most likely factor is a labor-triggering chemical found in oral bacteria named prostaglandin. This chemical is actually found in oral bacteria strands found in periodontal disease. High levels of prostaglandin can reach the placenta through the bloodstream and restrict fetal growth and can cause the mother to initiate labor and give birth prematurely, resulting in a baby with a very low birth weight. Pregnant women should visit the dentist on a regular basis throughout their pregnancy as to get an insight on what's happening in their mouth so they can continue to take the right steps of good dental hygiene at home. Even though oral health might be the last thing on a woman's mind, it should be one of the most important to consider.